Learn Chiropractic, Part 5, Spinal Evaluation, Orthopedic and Neurological Tests. Chiropractors and physical therapists often use orthopedic tests as part of the patient exam. These tests involve having the patient move a certain way and observing the results. Orthopedic tests check for signs associated with a suspected condition, such as a bulging disc or pinched nerve. A positive finding supports evidence of that condition, a negative finding does not. Since there are too many orthopedic tests to discuss for the purposes of this course, I will demonstrate two that chiropractors often use, the leg length test and sacroiliac joint lesion test. The leg length test can be used to determine the presence of subluxation of the L5-S1 joint or pelvis, or the upper cervical area, that is occiput to C2. If you get a positive test, motion palpate the area and analyze on X-ray to confirm so that the proper chiropractic adjustment can be given. With the patient prone lying in a straight line, grasp her ankles, lift her feet and set down, and check the alignment of her heels. Normally, the heels should line up, but note that in this case, the left heel appears about 1.5 inches shorter than the right. This could be caused by a misalignment in the lumbopelvic area or the upper cervical area. If the pelvis is tilted upwards on the left due to a subluxated L5-S1 joint, it pulls the left leg with it, causing it to appear shorter compared to the right during the leg check. A second possibility is that an upper cervical vertebra is subluxated in rotation, causing deep spinal muscles attached to it to contract and lift the pelvis on the left. It is important to determine which area is causing the leg length discrepancy. If the wrong area is adjusted, it will not provide the desired outcome or may even worsen the problem. To determine if the cause of the apparent short leg is in the pelvis or upper cervical area, have the patient turn her neck to the left and then to the right. If this movement causes the leg length difference to change in any way, the cause is likely in the upper cervical area. As the patient lifts and turns her neck to the left, there is little change in leg length discrepancy. But as she lifts and turns her neck to the right, it causes the leg length difference to increase slightly. Turning her neck back to the left reduces the difference. Since the C1, C2 vertebrae turn in the same direction that the head turns, and turning her neck to the right increases the leg length difference, it is likely that the C1 or C2 vertebra has a right side rotational subluxation. In this case, an adjustment to C1 or C2 on the right may be indicated. Do motion palpation to determine which one to adjust. After the adjustment, repeat the leg length test to see if the problem was corrected. Another orthopedic test is the sacroiliac joint test. Using your left hand, stabilize the sacrum with firm pressure. Instruct the patient to raise her left leg, keeping her knee straight as high as she can. Note the level. Then have her raise her right leg and compare levels. They should be equal. The lower side may indicate a sacroiliac joint fixation, in this case the left side. Neurological tests are sometimes indicated to determine if there are signs of nerve involvement. They include cranial nerve tests, sensory and motor strength tests of the upper and lower extremities, and deep tendon reflexes. Vertebrae may physically inhibit nerve root function by placing pressure on them, so testing cervical nerve root function is another tool to evaluate for subluxations. The cervical nerve roots C5, C6, C7, C8, and T1 combine to form the three main nerves that service the upper extremity, the median, ulnar, and radial nerves. These nerves have motor, that is, for muscles, and sensory, for feeling sensation, nerve fibers. Since it is known which muscles each nerve root innervates and the specific region of the skin each nerve root senses, we can do tests to assess their function. To test the C5 and C6 nerve roots, have the patient pull her arm as hard as she can with her elbow bent as shown as you offer resistance. To test C7, have her push your hand as hard as she can as shown as you offer resistance. To test C8 and T1, Have her open her hands wide and instruct her to resist as you attempt to push them in. Motor strength is compared bilaterally. If one side is significantly weaker than the other, it could be due to nerve root compromise on that side. To test C6 nerve root sensory function, run a pinwheel over the outer border of the forearm down to the thumb. To test C7 nerve root sensory function, run the pinwheel over the back of the forearm down to the index finger. To test the C8 nerve root sensory function, run the pinwheel along the inner border of the forearm down to the pinky finger. Tap the biceps tendon with the reflex hammer to test the C5 nerve root. Tap the brachioradialis tendon to test C6. Tap the triceps tendon as shown to test C7. Compare the strength of each reflex bilaterally and take notes. The lumbar nerve roots converge and form nerves that service the motor and sensory function of the lower extremities, that is, the pelvic region, legs, and feet. The major nerves are the sciatic, tibial, sural, saphenous, peroneal, and tibial nerves. Since it is known which muscles and areas of skin the lumbar nerve roots innervate, strength, sensory, and reflex tests can be done to assess their function. To test the L4 nerve root, have patient attempt to extend her knee while she is seated as you offer resistance. To test the L5 nerve root, have patient bend her ankle upwards against your resistance, as shown. Then have her bend her big toe upwards against your resistance. Repeat the tests for the other side and note any significant differences in strength. Test L4 nerve root sensory function by running the pinwheel over the inner side of the lower leg. Test L5 by running the pinwheel over the outer side of the lower leg. Test S1 by running the pinwheel over the outer side of the back of the lower leg. Test S2 by running the pinwheel over the inner side of the back of the lower leg. Tap the patellar tendon as shown to assess L4. Tap the Achilles tendon to assess S1. Compare the strength of the reflex response on both sides and take notes. In summary, orthopedic and neurological tests are useful for locating and assessing biomechanical problems. While they do not offer empirical information, they are instrumental when determining what to adjust and how to adjust it. Additionally, the orthopedic and neurological tests demonstrated in this video can be used to measure improvement from chiropractic treatment. If you get a positive finding, such as a positive leg length test for upper cervical subluxation or a weak C6 dermatome sensation on the left, retest after adjusting the affected vertebra to see if the adjustment corrected the problem.